5 minutes for your question, please.
Thank you very much, Mr. Chairman, and thank all of you for enduring this. We appreciate you being here and for sitting through this and for participating. I want to start with you, Mr. Holtzik, and you pointed out throughout the hearing today that that premiums are rising and that insurers are dropping out of certain markets. We know the horror stories of some states don't have but one insurance company that's participating now. And full disclosure, before I became a member of Congress, I was a pharmacist. I owned 3 independent retail pharmacies at that time. And I am a firsthand witness to what has happened to the free market in health care since the Affordable Care Act is taken. And I think that's the worst thing that has happened, is that it has taken the free market out of health care. How do we get it back? How do we get back to where we're competing? I often tell the story that right now Adam Smith is rolling over in his grave to see what we've done to the free market in health care. And how do we get the competition back? That's what's going to drive prices down, competition.
It's a hard question. I think the hallmark of a good competitive system is some flexibility in the rules that surround competition. And I think the mistake of having something that's the same across all states, where the market structures are very, very different, is piece number one. Piece number two is you compete on whatever you pay for. And so if you pay for procedures, people will compete by producing procedures, and we want to pay for good outcomes.
You know, there are really three things that we want to do. We want to make health care accessible, we want to make it affordable, and we want to cut out the red tape. We want to get the federal government out of the way of physicians and patients. Right now, there's so much bureaucracy between the patients and the medical and the healthcare professionals, and that's what we're trying to do, is to cut it out. Mr. Weisky, I want to ask you, because you have obviously experience in this. One of the things that I'm concerned about is the antitrust laws as they pertain to the insurance companies, and I really feel like this is hindering competition in a number of different ways. I'm really big on trying to find out exactly what's going on with prescription drug prices, and particularly the role that PBMs play in that, because I don't feel like they bring any value whatsoever to the healthcare system. They only raise prices and cause them to rise. And when you look at the PBMs, you've got 3 PBMs that have 80% of the market. That's not competition. Yet they're protected by the antitrust laws. I mean, did you address that in Wisconsin at all?
So, I think what's interesting about the ACA market from an antitrust standpoint is actually that the insurers are competing not to get business. And I think that's where the problem is coming in. In fact, in one state, they specifically wanted to get out of the cities, and one company only wanted to do the rural areas so they'd have less enrollment. And so, I think that's what's interesting, is they're actually not competing to get this business. They're competing to survive and just hope to live another day.
Okay, let me ask you this, because you said something earlier that really tweaked my interest. And you said that in your high-risk pool that you had in the state of Wisconsin, that all providers participated.
They did.
Did you require them to? How did you do that?
It was required.
How do you require them to?
So it was when
they tied in with licensing or something?
It was a requirement that they had to accept the high risk pool patients and the rate that the high risk pool set. They were part of the board, so they got the opportunity to work on setting those rates. But they were expected to contribute 30% to the surplus of the cost, 30% of the cost.
Okay, you explained that, but yep. What was the penalty if they didn't participate?
We never ran into that. So we didn't have a penalty because they all participated. The patients went to the doctor billed the high-risk pool for their services. I mean, ultimately, if they didn't participate, they would just wouldn't get paid in the same rate, I guess. But functionally,
I find that hard to believe, especially if you got a favored nations clause in there, and they're forced to accept that payment, that rate payment, and then they're forced to give it to another insurance company as well.
We had before and after, we do have an extremely competitive market, so we don't have a dominant insurer that can get the most favored nation. The market share in Wisconsin, the top about 18 comprise 80%. So, and the top 10 only comprise roughly about 45% or less of the market.
Well, again, I just want to stress, and again, thank all of you for being here. I want to stress again, what we're trying to do here is to make healthcare accessible, to make it affordable, and to cut out the red tape. And to bring the free market back. Let competition drive prices down. That's what's going to do it. That's what we're trying to do. Thank you again, all of you, for being here. And I yield back.